Hello, and welcome to another edition of the 80-Hour Workweek brought to you by the Denver Health Residency and Emergency Medicine Technology Committee. My name is Zach Giroux. I'm a fourth-year resident, and today I'm going to teach you about 5 mobile apps that will make your life better. Vala Afshar is the Chief Digital Evangelist for Salesforce, and in a recent tweet, he highlighted numerous previously standalone technologies that have been incorporated in today's mobile devices. It's obvious that he doesn't work in the field of medicine, though, where we still use pagers to contact consultants, landlines to provide EMS medical control, fax machines to exchange health information, and have to manually upload radiology images for patients transferred from outside facilities. The good news is that iPhones do make great reflex hammers. So while we still got a ways to go for our mobile devices to replace many of the antiquated technologies that today's healthcare system still relies upon, there are many apps that you can use to be a better doctor. The first app that we'll talk about is the mobile companion to Epic EHR, called Epic Haiku. It's available for Apple and Android. To set up Haiku at the University of Colorado Hospital, download the app and then use the mobile device on which Haiku is installed to open the first Google result when you search UC Health Haiku. Scroll down the page until you get to step 2 and then click the link to automatically configure Haiku to connect to the university's installation of Epic. Once your Haiku is linked to the university, you should see UC Health PRD appear at the top of your Haiku landing screen. Clicking this text allows you to switch between configurations at different hospitals. Configuring Haiku to connect to Denver Health requires leaving the Haiku app and entering the main settings app for your phone. Navigate to the settings for Haiku within the main settings app of your phone and manually enter the data seen on the screen. Only one custom configuration can be stored at a time. Epic is a great tool to capture clinical images of soft tissue infections, burns, trauma, difficult to describe exam findings, and exam findings for which you'd like to obtain a virtual consult, or to timestamp exam findings which may need to be examined by another provider at a later time. You can also take images of outside EKGs, medical records, and I've even taken a picture of the ultrasound screen when I couldn't get images to save to PACS. Images can be reviewed under the Chart Review Media tab and can also be included directly into the body of your note. A second great way to make use of Epic Haiku is its voice transcription feature available within the Note Entry tool. The transcribed text can then be directly inserted to your scribed note using a smart link. Finally, are you sick of being the last person on your team to know that a critical or disposition limiting test has resulted? Use Notify Me when placing and reviewing orders to automatically have results of desired labs and imaging pushed directly to your mobile device. App number 2. Have you ever taken care of a patient who ended up in the ED because they couldn't afford their outpatient medications? Have you ever had a patient who was worried about the cost of medications you were planning to prescribe or wanted to know which pharmacy would have the lowest price? From the creators of GoodRx.com, the GoodRx for Doctors app, also available on Apple and Android, can help. Using the app, you can create a list of meds that you frequently prescribe for easy access. You can find the results and the price information in your local community, and you can also use the app to send coupons to patients so they can get the lowest price possible without ever revealing your contact information. And don't forget to ask the patient what pharmacy they want their medication sent to before you leave the room. E-prescribing is an eco-friendly and will save patients and attendings time, since the nurse won't have to chase down the printed and probably not yet signed prescription, and the medication will be ready for pickup as soon as the patient arrives at the pharmacy. App number 3. Have you ever wanted to call a patient after their visit to see how they're doing? Or wanted to contact a patient's friend or family member to provide collateral information? Or have you been the unlucky and confused recipient of a direct call by a patient or family member directly to the senior, TJ, or pullback phones? Doximity Dialer can help. Enter the phone numbers of the hospitals, departments, or clinics you would like to make it appear that you're calling from, and call without the fear of revealing your personal cell or department handheld phone number. And for those who are really into receiving faxes, you can also use the regular Doximity app to create a free virtual fax number to receive patient records. App number 4. Who here has seen a patient they believed were engaging in opioid-seeking behavior, or had to give Narcan to a young person in respiratory arrest after an overdose? If you're not at a site with an EHR that automatically pushes prescription drug monitoring program information, or you find the web-based PDMP system difficult to use, you can now log into the PDMP using only your fingerprint with OpiSafe Pocket PDMP. OpiSafe PDMP will remember the list of patients you've recently queried, provide information about prescribers, pharmacies, and recent prescriptions filled. Last but not least, app number 5. If you've ever received an email about late duty hours, or are behind on logging your procedures, or you aren't receiving enough written evaluations after your shifts, or you're looking for an easier way to give feedback to the attendings that you've worked with, the new MedHub app is a must-have. As mentioned, you can use this app to log your duty hours, log your cases and procedures, and you can even use its voice transcription tool to leave feedback for your attendings. In closing, make your life easier. Download these apps. For questions, comments, or suggestions, please email techcommittee@denverem.org. Thank you.